Our senior reporter, Tumaole Mohlaoli, is in studio with us to help us unpack what the president had to say. And perhaps, Tommy, let's start with the broad strokes of what Ramaphosa had to say last night in an address that was actually largely anticipated.
Yes, largely anticipated, largely expected, and no surprises there. But basically what he had to say in terms of lifting the COVID-19 regulations is that, the worst is not necessarily over. People still have to maintain the various behavioral changes that have been implemented over the last very difficult 2 years, social distancing, in terms of wearing masks, for instance. Out in the open, or if you're walking up and about the streets, you don't necessarily have to wear a mask. But if you're in an enclosed environment, like indoors or in a classroom or, in a building, you still have to wear your mask. Social distancing still applies. The various, issues like washing your hands and sanitizing, those still apply. But when we look at, in terms of the National Health Act itself, once the period of public comment that will be closing on the 16th of April, comments that will be considered in terms of regulations will be finalized and promulgated. So this period that we're in right now is essentially just a transitional period, but the public comments and the healthcare professional comments will be taken into consideration, and once promulgated, they will then effectively be law, which means then that will be non-negotiable, and that's what people will have to adhere to. So certainly something to look forward to there.
Yeah. The President in his address also emphasizing that we're at that stage now of the pandemic where really it's up to you and I how we behave in terms of COVID-19 in the face of what analysts have been telling us will be a fifth wave of infections.
Yes, and with the fifth wave, obviously, comes unfortunately more deaths that are anticipated, but the responsibility is now back in terms of personal responsibility. So people will have to adhere to those, non-negotiables, as I mentioned earlier, when it comes to, sanitizing, as well as social distancing, as well as making sure that if people aren't feeling well and suspect that they may be infected or maybe affected, then the self-quarantine measures still apply. So certainly the individual will now be, the one who will be tasked with making sure that they take care of themselves and by extension taking care of others around them.
Yeah. So what's important this morning is that we're waking up without a lockdown after 750 days when this was initiated. I think that's something to really try and take in. But it also does lead us to asking questions around how easily we can be brought back to this place again if the need arises. I'm sure, there'll be some kind of thoughts, conversations around how easily, for instance, the President can announce the state of disaster again.
Yes, and that will also depend on the outcome of what will happen for the next 30 days in the transitional period of things. Of course, the state and the President and the Health Department will be watching the figures very closely, watching the front line, which will be our hospitals and our healthcare facilities. And of course, if there is something of a concerning spike that comes in, the President does have the powers to reinstate what was, of course, the emergency measures. And this is, of course, we must all remember to save lives. That's the most important things. Many people are celebrating, saying that, well, with the lifting of the lockdown, it means the economy can now get back into full swing. It's been a very difficult period, both emotionally, physically, but also economically for many people. And with the economy coming back into full swing, this will be a welcomed relief for many. But at the same time, if people are getting sick, there will be no economy to be, worried about when lives are lost. So that's the most important thing that the government is looking at and will be looking at very closely.
Yeah, absolutely.